Okay, so I'm going to be inserting my IV. I'm going to gather my supplies, verify the provider orders, and I've performed hand hygiene. I'm going to then complete my 2 patient identifiers with the first and last name and date of birth. I'm just going to apply my gloves. And I believe usually we use sterile gloves, but our kit only came with 1, so I'm going to then clean the area with my chlorhexidine. I'm going to clean that vigorously for at least 30 seconds. And then while that dries, I'm gonna go ahead and prime my tubing. So I have my tubing here. I'm going to take the cap off and connect my 0.9% sodium chloride solution. And I'm just going to prime my tubing to ensure that everything is set. Alright, and we have the solution coming out the other end. So that's ready to go. I'm going to apply my tourniquet to the patient. So there's the tied tourniquet right here. I'm going to grab my needle. And I'm using a 20 gauge needle. Taking the cap off. Just gonna loosen the plastic. Perfect. And I'm going to make sure the bevel is up, like so. And I'm gonna feel for the vein. Alright, I'm going to ask the patient to take a deep breath in, inserting at a 10-degree angle. I'm going to then advance the catheter. Holding pressure to the thing, capping my needle, and putting this in the sharps container. I am next going to attach the extension tubing. Like so. And I'm going to release the tourniquet. And then I'm going to flush the IV once again with that solution. Alright. Then I'm going to clamp the tubing. Going to remove I'm going to then secure the IV with a Tagaderm. making sure that the IV is in place. And I'm going to then initial and date the IV site with today's date and my initials. Can go ahead and remove the solution. This is when I would medication, and then I'm going to secure the site with tape. And depending on the client's state, if they are bedridden and not very mobile, I won't tape it as much, but if I know that the patient is confused or in an altered mental state, I would tape it more. And that's it. Hi, Dr. Rocha. This is Nurse Paloma Curiel from the Thompson Peak Extensive Care Unit. I'm calling about Mr. Johnson, age 86. He's had a change in his condition. He has a new onset of shortness of breath and confusion. He did skip his midday meal and hasn't taken any extra fluids. Mr. Johnson has emphysema and he doesn't usually show signs of confusion or altered mental state. He was documented to be confused and wandering the unit this morning. His vitals are normal, except he does show a low respiration rate of 8 and shows struggle in taking deep breaths. He does also have a wet cough and has been releasing an increased amount of sputum. Yeah, I am wondering if his emphysema is worsening. Should we schedule an x-ray or start him on oxygen therapy? Okay, thank you. I will look for the order.